Welcome. Pediatric Critical Care Medicine, October 2022, another great read. I've got 3 editor's choices. Firstly, an article by Pilato et al. Looking at delirium and subsequent readmission to the PICU in a cohort of 1,100 patients from New York. This was a retrospective study, and there's an accompanying editorial. The second editor's choice is by Centers et al., and this is about enoxaparin prophylaxis in congenital heart disease patients who are at risk of catheter-related deep vein thrombosis. This is a pre-post protocol in study in 600 patients. There's an accompanying editorial. The third article is by Namichevayan et al. This is a meta-analysis of 9 studies, including 750 patients, and looks at early peritoneal dialysis and post-operative outcomes after congenital heart disease surgery. There is an accompanying editorial. In the PCCM connections for readers, 2 medical themes. The first is respiratory. There's an article about long-term pulmonary outcomes after mechanical ventilation for bronchiolitis. There's a physiological article about airways resistance. And there's a concise clinical physiology stroke science review about airway bacterial colonization, biofilms and blooms. The other medical theme in connections is cardiac arrest, and there's a survey about epinephrine dosing, either weight-based or flat dosing from ICUs in North America. 68 out of 137 responded to the survey. And the other article in this theme is use of sodium bicarbonate. And then finally, I'd like to announce that PCCM has taken a new section that adds to our PCCM narratives, and this is narratives in verse. We received an article from Toronto Sick Kids and their fellowship program by Proul et al., and this describes their experience of narrative medicine with clinicians writing verse about their experience and reflections within the PICU. They included 6 poems in this article, and on the strength of that, I invited Dr. Winnie Morrison to provide us with a poem for the narrative section. And she presents 150 words explaining the why and the what of the poem, and that's followed by the poem. I think this is an expanding section, and of course narrative medicine is becoming increasingly used in medical education. So that's all for October. I'll see you next month. Thank you.